Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Level of your house. Then you need to have railings on both sides of the steps, which many of us may not have. And then in addition to that, should have in bathrooms, you have grab bars. So you can grab onto things so you don't fall. And they have those in most locations, but probably not in your home. And then motion sensor lights, so you don't need the from for a switch at night. And then finally, you need to remove all floor hazards, which is something that is rarely done. And then finally, they say you should have a medical alert device. How many of you have any of those things?
I have most of them. Most of them.
Great, great.
I had a carbon monoxide one, but I had to cut it off because it got too sensitive. It was going off, and it was alerting something I had from my mother. I think when I had that alert for her, it was connected with that. But we ended up having the fire department come to our house twice.
Wow.
Wow.
Because they were notified when that thing went off.
Wow.
Yeah, I had a similar experience with a carbon monoxide detector. It kept going off.
That's
And
what that was.
Yeah, we don't have any we have radiators. We don't have any forced air, except for the air conditioner. But you really worry about that stuff in the winter, especially because everything's closed up.
Right.
Yeah, I don't know if I have any of that stuff. Well, we have smoke detectors, and I think we do have detectors, but I know the railings that don't have on both sides of steps and don't have grab bars and don't have motion sensor lights. And
You have to get fire extinguishers. I don't have any of those in the house.
yeah,
I got one, but it probably too old. I think you're supposed to change them after a while. I think mine might be 4 or 5 years old.
I've got grab bars in a couple of my bathrooms.
that's good.
John, your father put grab bars in our bathrooms up here.
I think I have everything except the grab bars. And we did motion sensors when we moved here at night. David was always tripping and falling. And it helps. I mean, now I'm used to it. You walk into a room, the light comes on, not bright light, enough for you to see.
Yeah, that's nice.
Yeah, it's helpful.
Yeah, we're behind the times in my house. Wow. Yeah. Anybody have Parkinson's disease in the group?
No.
My father may have had a little bit of it. He was having hallucinations.
Well, that's okay, but anyway, that's usually not part of Parkinson's disease
Yeah.
because it's a motion problem, movement disorder. But it just says that 4 hours of exercise will slow down its progression. Is really nothing. There really isn't any good treatment for Parkinson's disease. But they mentioned they did 4 hours of exercise with a study with 237 adults, and they found that that was one that was effective.
When you say 4 hours of exercise, over what period of time?
1 week, 4 hours a week. 4 hours a week.
What causes sciatica?
Oh, that's when your nerves are pinched by the discs, because you have a nerve, sciatic nerve that runs, it leaves the spine, the vertebral column, and anything that presses on that nerve will cause the sciatic nerve will cause what's called sciatica. Or if you have a disc, a lumbar disc that's pressing on it, that will cause it as well. But anything that damages the sciatic nerve would give you sciatica.
Would that be in the hip?
Yeah, the nerve comes out from L3, L4, L5, which is the hip, yeah, and goes down the thigh.
I think that's my latest.
Huh.
I have a doctor's appointment. Of course, non-medical people always like to diagnose you, and I've been told that's what it is. But my doctor's appointment isn't for another couple of weeks.
Mm.
Mm.
I have a question about the sciatic nerve. Does it go all the way up to your neck?
No,
From your heel to your neck?
no,
Where does
does
it go?
not. No, it only, as I said, only comes out around L3, 4, 5. It only goes down to your leg, to your thigh, leg. The nerves that go to the upper extremity come from the neck, the C4, 5, and 6, and they cause the radiculitis that gives you the pain in the shoulders. In contrast to the sciatic nerve, which only goes to the lower extremity.
Mm.
That sounds funny. Did you say ridiculitis?
Radiculitis, right,
Okay.
which is inflammation of the nerve.
Yeah. I don't know. Why is sciatica so common, Dr. Callender?
Well, back problems are common, and as you age, arthritis causes impingement upon the nerve as it exits the spine, and so that may be one of the reasons. Arthritis may be one of the reasons.
Is it also from sitting a lot?
That's what I'm thinking.
Yeah, sitting is not contributes to the problem. Yes.
Mm.
Janice, I think you'll be surprised about how many people on this panel right now have had sciatic. Ask them. How many
Really?
people have had it on this
Me?
panel?
I think,
All of us.
yeah.
Not me.
That's why I think people are so quick to diagnose you.
Diagnosis.
Yeah, because everybody that's had it and you give any of the symptoms of it, they're all going to tell you what you got and what you should do for it. Haven't they already told you?
No, I didn't say that, Carol. I was
I
very
know you
quiet.
didn't. I think on this panel, everybody's intelligent and nobody is telling.
But
Y'all didn't even confess you had it.
but it's not sciatica. Sometimes it's not sciatica. It's just a slip disc,
And that's why I need to go see the doctor.
and that requires a different kind of treatment.
Yeah. And if it's,
Use
you
traction,
wonder, do you
use-
move more or do you
Mhm.
move less? So I need to diagnose exactly what it is,
Yeah,
but
yeah.
I got a couple of weeks yet.
Because sciatica, if it is truly sciatica, it's self-limiting and it doesn't last so long. Whereas if it's a slip disc, it gets worse and worse, and it causes other problems, including muscular weakness and inability to use your bladder and other things. So if it's a slip disc, that's different from sciatica.
I saw it as another sign of age.
Well,
I think,
arthritis. Well, as you age, you have arthritis in different parts of the
Yeah.
body. Having
I
it
think,
in
I
the-
think between us all, we should be able to fix her. You don't need to go to a doctor.
Yes, you do. Yes, you do. You need to
You're right.
find out, make sure it's not a slip disc. If it's not a slip disc, it'll be okay. But
I
some
had a-
people wind up being paralyzed and many other problems because spinal stenosis could be a problem as well. And spinal stenosis is associated with a lot of disabilities. And you want to be sure that's not what it is.
I had a slip disc. I had the nerve, the disc pinching on the nerve, and I had gone to one doctor, and he was showing me this chart of what he was going to do, and put a pole here and a rod here and a this and that and the other. And then I went to another doctor, and he said he was just going to take off the part that was pinching on the nerve. And that's what I did. And that was 30 years ago. And before that, mine had got so bad I couldn't even feel my foot. It was numb.
Yeah. Mhm.
I couldn't even tell if my foot was on the ground or not. But when he
Yeah,
did that surgery, it cured all of that.
that's why you need to go to the doctor to make sure that's not what it is. Yeah.
Mhm.
Dr. Callender, what is stenosis?
That's when you have a narrowing of the spinal canal, and that squeezes the spine and can cause you to be paralyzed. And so that's a condition there. You can have the stenosis of the lumbar stenosis, or you can have cervical stenosis, which involves the upper extremity. Cervical stenosis does, and lumbar stenosis involves the lower extremity, which can result in your inability to urinate, to defecate, and to do many things. So it's important to know that you don't have stenosis, and that if all you have is sciatica, you're in good shape. Okay, John, you want to start on the 25 slide? I thought that was an interesting thought. It goes to show you that statistics don't lie, but lies figure. I mean, it's interesting. That's what the data shows. So we'll argue about it, just and why that's the case, I can't tell you, because I don't know the answer.
Is that because there are more male doctors?
I have no idea. I don't know.
So if you have a surgeon, it's better to request a female surgeon.
Absolutely.
I think that's data that remains to be seen how significant it is. I would draw no conclusions.
Okay, Darryl, you said absolutely, but it doesn't matter about you males. It's just females. We die more from male surgeons.
Yeah, but if a female dies in the family, that's family stress on the male.
But
Well,
that's just like man and make it about him.
My surgeon's a female, and I went to see a male surgeon, and there was lack of compassion there. I'd
So
rather
who,
deal,
the
I'd rather
male
deal with a
surgeon?
female surgeon.
Okay.
Well, we've already had studies that say that women have more emotional intelligence than men.
Yeah, if you believe those studies. Yeah, I believe that.
Huh?
No.
You don't
I think
believe it?
No, I think compassion is something that needs to be there, whether it's male or female. Compassion is one of the most important aspects of medicine. So, and you may have more women who are compassionate, but I think compassion is the important aspect of it. And maybe that's true. I don't know. I just don't believe it. I think compassion is what really matters in medicine. Compassion, caring, and kindness trump almost everything else in medicine.
I believe that too.
Now, this is another one, going to bed late, and it causes a premature coronary artery disease. It's interesting, and they have a cohort of 30,000 patients. It makes you think that they talk about the time you should go to bed, the time you shouldn't, and they say that the time between 10 and 11 may be the best time to to go to sleep, and the people who don't follow that have premature coronary artery disease. It's interesting that it says. How many of you go to sleep later than 10 or 11?
I do.
I
I
do.
12,
I
1,
do.
1.
1.
One is a good time.
Especially for retired people.
Well,
Well,
But
anyway, this
Dr.
is a
Callender,
study. Yes.
it-
What time do you get up? I mean, if you go to bed at 1, I mean, and you get up like at 10, did you get
Yeah.
the full sleep?
Well,
Yeah,
see, that is not factored in this study, because your point is well taken. What you're saying is that you need to have 8 hours of sleep,
right.
and so if you go to sleep at 1 and get 8 hours of sleep, doesn't matter. I don't know that study doesn't address that, but those are aspects of it that we want
What are
to.
they doing late? Are they looking at, inflammatory things? Are they looking at, worrying
This,
about the world, or
and
are
this
they,
doesn't say. This doesn't
Watching
say.
movies.
might contribute to it?
They're mostly watching movies.
Well, I think, and it is, the studies doesn't say this, but I think the most important aspect of it is what you mentioned. How many hours of sleep do you get after you do that? Because we all remember the studies that we've talked about here that demonstrate that good sleep is important to the brain because the brain is purified as you sleep, and the metabolism of the brain is critical. And so it's not only when you go to sleep, but the quality of sleep and how long you sleep.
Yeah, Dr. Callender, as a retiree, normally I just allow my body to wake me up, not unless I have an appointment to go to. So when my body says get up, then no matter what time I go to bed, I don't, have to get up like at 7 o'clock every morning. I just say, okay, whenever I wake up, and maybe I don't know how many other retirees have that luxury, but that's something that I do.
And I'm still adjusting to being not a new retiree, but my body still wakes me up at 5 because that's my normal time to get up to get started my day. And it doesn't matter what time I go to bed.
Yeah, I'm a very late night person. So I mean, I work a lot of times from 10 to 2 in the morning. So I might get in at 3 or 4 in the morning. But like you, I get my 7 or 8 hours of sleep regardless of when I go to sleep.
Well,
Sometimes it's what you do
don't.
when you're up. If you're up and watching television, there's also this issue that we eat a lot of junk the later we stay up. And so if you're up eating things that are unhealthy for you, then that can also contribute to your risk for coronary disease, because the things we eat late at night are usually not the things that are best for us.
Like cookies.
Yeah.
And eating at night isn't desirable either. But go back to what you had underlined, because I think that's a key factor in every study. It's who's doing the study and who they're studying. And this is comes in the Iranian medicine. And it may be true for Iranians, but I don't know. And as Velma indicated, eating at night is not that healthy. Not healthy, period.
All right.
Popcorn.
This is healthy right here.
Now, this is exercising after COVID is interesting because I didn't know they had done studies to identify how you should and when you should start exercising. Well, that's the question. When's the right time to return to exercise? I remember Darryl talked about he waited a week after he recovered from his COVID to start exercising. And I remember that Buchanan also waited a while before he started his exercising again. And this now has been studied. And you can see that in this study that at the bottom of this, they make some recommendation about when you should start exercising after you've overcome the COVID experience. And this little question that exercise is beneficial, but when you get the chronic syndrome, the question is, when is it best to start exercising again? And this talks about the types of exercise as well, and also how should you monitor. And this is what they say: on an asymptomatic stretch of seven days. That's what they decide is the most sensible. Is that what you did, John and Darryl?
Yeah, that's exactly what I did. Symptom free for 7 days and then started back the exercise.
Right. Common sense, huh?
I did the same thing.
Yeah. And that's what they're recommending. It's interesting.
I had a quick question. Let's see. What is this right here? Pneumonitis.
That's inflammation of the lung. Because that is sometimes, as you know, COVID-19 was killing people because it was inflammation of the lung. And that's what was killing people, the pneumonitis.
Yeah, I have a friend. I have a friend who's a nurse who got COVID before the vaccines were out, and I mean, he was going to the gym at 5 o'clock in the morning almost every day, and you know, he had stopped, you know, when he was real sick, and then went back, but he still complained about having shortness of breath and things like that.
Yeah, that's pneumonitis. Yeah. Yeah. So, but I think the best advice is 7 days after you're asymptomatic. Now, one of the problems is that, as you know, COVID-19 has only been around for 2 years, so getting a lot of data on this is not that easy. Callender, any thoughts on this? Anyway, you can see here that the data is not voluminous. So I guess the 7 days after you're asymptomatic makes the most sense. This is interesting, something that we've discussed in the past because Keith Norris and many others have felt that it's appropriate to have equations that are different for African Americans and others. We know that the rate for kidney disease in African Americans is 4 times that in whites. But we also recognize that males and black men have more muscle than women, and black men. Therefore, the creatinines may be higher, and as a consequence, they actually have a different GFR for African Americans than they do for whites. And some have said that this delays life-saving transplants. I'm not one who agrees with that, but it'd be interesting to hear.
What is the GFR, doctor?
Oh, glomerular filtration rate. For example, normally you'd like it to be at 100, and if it goes below 20, then you start dialysis. So you've got a long way to go from 100 to 20. But if you have a GFR, which is what they use to decide when you're going to be going dialysis. But one of the things that you have to keep in mind is you don't need to go on dialysis to have a transplant. You can have a transplant when your creatinine clearance is at 25, or even so. So to me, it's not an issue, but many feel it's important to discuss. And many of the nephrologists, including Keith Norris and many others, have felt that it's important to have that difference. And right now, people are trying to decide whether this is racism or whether this is something that is actually legitimate. Dr. Callender, are you still here? And she may have gone. But anyway, it'll be interesting to hear what her perception is. Keith Norris is one of the eminent nephrologists that felt strongly that this is the case.
Yeah, I'm still here. What was the?
Oh, you have any thoughts on this subject?
On the EGFR?
Yeah.
Well, certainly it's definitely is something that needs to change. And the issue is that there are other ways to calculate EGFR. And I can honestly say I have always been bothered by the fact that you look at your lab slip from LabCorp and you see Black and non-Black. What happens to people who don't fall into either category? What would Tiger Woods put? He is Asian, Black, neither Black or, so that is always an issue. And so there are other methods of calculating EGFR. And if using races put people at a disadvantage, it certainly isn't the way to go. And if you think about the fact that looking at the statement for even the American Society of Transplantation, the way we assess and do the KDPI for donors, race is a component that allows you to have a higher or worse score for a donor. So therefore, if you're a Black donor, your score for donating that kidney is, if you factor in race, then people then say, okay, no, I don't want that kidney. That KDPI is too high. And so it can have a negative effect. And so therefore it becomes important to not use it because it's not a part of it. That doesn't, race is social construct. It's not genetic. And it should be anything genetic. If it's based on race, you don't say, and we look at society and the way we address even issues in terms of our history of present illness, we go, this is a 25-year-old Black male. Why do you have to bring race into it? So that's my soapbox.
I have a question. What has been the result of using this so far?
So when you look, yeah, go ahead.
No, go ahead. Go ahead.
Yeah, when you look at creatinine and the clearance of creatinine from your body, if you are, the factor is that the issue is that when you put race into the equation, it allows for someone who is Black you're then assuming the formula accounts to say, okay, I am going to take away the fact that you have a higher creatinine, you have more muscle and a higher creatinine as a Black person. So I am going to make it equal. So you then take a muscular male, Black male, and you put in race in that factor, it falsely lowers your EGFR. It makes it higher. So your EGFR is going to be better than what it may be. And so your EGFR might come out to be 25. And you take those same parameters and give it and calculate it for someone who's non-Black that doesn't have that race factor, and suddenly your EGFR is going to be 18. So if I'm Black, I may not be eligible to get on the transplant list because you have falsely elevated my creatinine clearance by putting in this factor. But if I'm white and you don't use that factor, suddenly I am now in a position to get on the transplant list because it's under 20%.
I see. Okay.
Yeah, and I would say that I agree with you, Velma, but except I'm even stronger than you. I feel that race is a social construct and should have nothing to do with anything. We're all Homo sapiens,
Right.
okay? And the Human Genome Project made that clear. But yet we hang on to this race social construct and act as though it's biological. But anyway, that's my soapbox, Velma.
It is. And so that's why, the question is, who put race in there? And it became acceptable for all these decades that we've been using that formula, because it was just acceptable, but, we didn't, it took till this, to be able to say, now this needs to be questioned and be able to say, we need to do something about this on a national level. Even though we might have questioned it on a personal level, now we have LabCorp taking it out of their formulas. We have hospitals saying, we're not going to use this anymore. So we needed that national platform to get recognition and to get something and to get action.
Well stated, well stated. Any other questions about that? Because it's a topic that has been addressed and made a tremendous issue recently. This is something that the digital vaccine card has emerged. It's interesting because now, because of the Omicron, when you go to basketball games or anything like that, you now have to prove that you've been vaccinated. And so this brings into the digital cards that may become operational. It's not yet, but it's something that may occur. The question is, can you forge this like we read about basketball players who got fake vaccination cards? They get fake digital cards. I don't know. So it's food for thought. But this is something that may or may not come to pass. Some nations have used it and some haven't. You can see here that some states have already issued the codes.
Dr. Callender, I think if you had something like a national database where, let's say they had their own app and that app is, downloaded, maybe that would work. Just to have a digital card and not have a national database that I'm thinking that has an app where you can download on your phone that will show that you actually have been vaccinated. Without that kind of national database, I don't know how this works.
And that's interesting because that's where I would think as well, that if we had a national database, then it would work. And we still have those people who are strong advocates for not needing vaccines. So, but I feel as you do.
Dr. Callender, the vaccine, since I had COVID and I was fully vaccinated, it almost seems like the vaccine card is not enough, okay? Because before I was symptomatic, I could still give it to someone else being asymptomatic. So the vaccine card doesn't really protect anybody else, but it protects me, keeps me from going to the hospital and dying.
That's the purpose of a vaccine.
Right.
That's the sole purpose of the vaccine.
So why would you?
People kind of forget that the real purpose of the vaccine is to keep you alive, keep you from getting to the hospital, and keep you from dying.
Okay, so why, this is a hypothetical question. Why would you check someone's vaccine status if it's not really for everybody else, it's for that individual?
It is for everybody else, but it depends on your perspective. I mean, it's for everybody to be aware of the fact that if you have if you've been vaccinated, the likelihood of you or dying from the infection is less than somebody who's not been vaccinated. So it's for every single person.
I understand that. But
Okay.
as far as going into like a restaurant or a club or something like that, okay, you're protected, but what's your status right now? Are you positive or are you negative? So I'm thinking that testing, this is where testing comes in. We have some articles about that. Testing is really more critical than the vaccination for getting back mobile. You know what I mean? Getting back.
Well, it depends on your perspective. Yeah.
Mhm. I mean,
Yeah, because that means you have to test everybody before they come into the restaurant,
right.
which is not practical.
Okay.
Dr.
Because
Callender,
how long does the result take?
10 minutes.
It depends. Yeah. Well, it depends on the accuracy of the test, which test you take. You're right. And so,
Dr. Callender, can you explain the difference in the definition between symptomatic and what asymptomatic?
means you have no symptoms, no sign or symptom of any disease. You're perfectly healthy. When you're asymptomatic, that's what it means. You have no signs of illness. That's all it means. No signs of illness.
No signs.
Symptomatic means you have signs of illness.
Okay.
Dr. Callender, just a sidebar. The thought came across my mind. We're in a day of age, and you can tell me about this. Everybody has a phone, and I was looking at, we're that Asian country, and they got to show their phones. Are there any countries or any place in America where people are too poor to have a land phone or cellular phone? I know welfare people are getting phones too, but are we in a society that everybody got a cell phone?
Well, there's no rule about that, but most people do.
And that means we're really rich.
Well, not really, because they actually give some of the homeless people, they give them cell phones as well.
They got Obama phones.
Yeah.
Okay. Does anybody on here know of anybody without a cell phone?
Yeah, there's places in the South, Mississippi, I'm thinking of, where people not only don't have cell phones, but don't have internet access.
That's true.
And there are many places here that people don't have internet access.
Mhm.
Okay. And what
But
about
a lot of businesses now assume that you have cell phones, computers. Every time you try to do something, go to your app, log on your account.
Right.
How do you get on that account if you don't have a computer? How do you do that if you don't know how to use a computer? Then you try to call and you don't get anyone.
That's the problem.
Or you call and get the automated system and it can't help you.
Right.
You know,
that's one of the problems, is that the presumption that everybody has internet access.
when they were giving out the vaccination in DC, they assumed that once they put it online where you could register and get your shot, and that fixed everything. But everybody over in my neighborhood, son, daughter, grandson, granddaughter, all of them had internet access and could log in right at 8 o'clock and suck up all the vaccinations. That's why they had to reset the whole system and do it by ward 7 and 8 and 9. At a certain point, me being in Ward 3, I could not get a vaccination because all the folks in my neighborhood has sucked up all the vaccinations too quick. I mean, I'm literally within 10 minutes, 8,000 vaccinations were gone. Most of them went to the more affluent areas in DC that had access.
So true. So
that happened in two areas I know. In the school system, where you had children, even the homeless, they weren't able to get the computers and do the virtual learning. And then John is the president of the retirees for the teachers union, and they're having problems. They can't get the medical register for dental and visual because they don't have computers or they don't know how to work the computers or something, and somebody has to help them go online so they can get the insurance that they need. So when we're thinking of our society, everybody with cell phones or computers, and computers do cost money. They're acting like these items are free, like, or something, necessity of life, like electricity and water.
Very good points. Very good points.
Can I say that regarding my 90-year-old mom, who has a smartphone because she's on my account, that normally when I have to set her up, I had given her a Gmail account, but my telephone number is on basically all the accounts. So I'm getting the alerts so that then I can pass them on to her. Whatever comes down, I'm getting all the notices, and then I pass. So you do have the opportunity to put maybe your own cell number on a lot of these things, so that if like for my mom's case, she has a Gmail account, but my cell number is on there. So I'm getting all the alerts and everything that she needs, and if I can pass it on to her.
You're a wonderful daughter.
Yeah.
Wonderful daughter.
And it's hard for seniors because when the seniors first got the vaccination, and once you got your vaccine, then you had to sit and wait 15 minutes, and they give you a piece of paper and say, go online and register for your second shot.
Right.
And the seniors were sitting there, they couldn't do it. So I was sitting there and I did some for a few people. So then when I got home, I just sent an email to our Ward 4 councilman and said, well, what? This is wrong. You should be able to get an appointment right there before you leave versus telling somebody to go sit somewhere and try to get one. And these are seniors and they don't know how. And then all of a sudden, I noticed that they start giving you an appointment to come back to get your second vaccination. But it was at first, they didn't do that. And it was hard on a lot of those seniors.
Well stated. That's how inequities are manifest. And sometimes it's not because it's well thought out. They just don't think about it. They think everybody's got cell phones and internet access. Forgetting that there's about 10% of the population that does not have internet access.
Like for instance, the message that went out 2 days ago about logging on to the UPS to get your 4 kits of at-home testing. You have to do it online. So again, you have to say if your mother and your grandparents don't have access to, you can go in and put in your address to be able to get these 4 at-home COVID kits that will be delivered by the UPS. But that requires technology again for those people who don't have it. Then they depend on somebody else to be able to get their at-home COVID test.
Yeah, and Dr. Velman, I did get the email from my mom, and I just completed it. So that's why I was saying is, it's very vital that you can put your cell number on a lot of this database, and then you can get your updates and help our seniors.
And it points out that these people are well-meaning. They just don't understand all of the social determinants of health. And this is one of them.
Don't forget, the other thing is that you have to have cell phone towers located in certain places. And that's hard to do when you're in the rural areas, and it depends on how many you have and how close they are in order for you to get cell phone access. You have to have cell phone towers.
Like on an Indian reservation. Native American reservation. Doc, at Howard, when I got my shots at Howard, they had a panel of assistants in the waiting area with laptops that could register you right there. I thought that was very well
sensitive.
Yes.
Yeah, very sensitive. Okay, well, the one thing about this group, you guys are very sensitive and right on target in most things. This is an interesting article about whether Omicron signifies the beginning or end of the pandemic. And Tony Anthony Fauci was cautious and said, in essence, it depends. He also talked about the fact that there's been only one virus that we've been able to completely cure, and that's smallpox. So that we haven't eliminated any of the others. We decreased them and made them endemic, but we haven't eliminated them. So he spoke pretty cautiously and appropriately when he indicated that it all depends. And whether there's a new variant or not. The point is that what it means is that we may need to be vaccinated again for COVID, just like we do for the flu. We get a flu shot every year because of variants of the virus. And similarly, we may have to do the same thing for COVID.
Dr. Callender, I have a question. The thing about viruses, this is a question. They tend to mutate, and we can't stop them from mutating. Is that correct?
Yes, that's correct. So therefore, we're dependent on vaccines to address the variants when they occur, because they invariably occur.
Dr. Callender, do we have any data on the recidivism? If you have had COVID already, what's your protection level? Can you still get it again? Like going around other people that are not vaccinated or not, that might be symptomatic?
I haven't seen any data. Velma, have you seen any data on that?
Yeah, I haven't seen any data, but I know that I have there's one patient who actually had it 4 times.
Whoa.
And so the question is, it all depends on your immunity, and certainly getting vaccinated and the antibodies you form from vaccination is different from the antibodies you have from natural immunity if you've had COVID. So it becomes important. It also depends on, and so the more antibodies you have, the better you're able to fight it off. It doesn't necessarily mean you're not going to get it. Your defense mechanisms will help keep you from getting sick and dying. But we know that the further out you go from your booster or from your last vaccination, the less antibodies you have. So like Dr. Callender said, we know that our antibodies wane at about 4 to 5 months, and that's probably just when we will need to get vaccinated, get another booster again, depending on how virulent the mutant virus is going to be. You know, the Delta was one thing, and so now who knows what the next phase is going to be. You just have to stay protected. And if you're immunocompromised, you just have to be careful and make sure you are staying safe.
Thank you.
Dr. Callender, this might address a question my husband had, who was vaccinated and boosted and caught COVID. And when he got the infusion shot, and then he said in his release papers, they indicated that we wanted you to come back and go back through the series of vaccinations again. And so he was questioning, wanted me to ask the question, does that seem normal? And what we're seeing now is it could be possible that the antibodies in your system may be low and you might need to go back through vaccination again. Is that correct?
Yeah.
The truth of the matter is we don't know, but it sounds sensible to me. Velma, you had a thought?
Well, you know, some people are being, maybe in the hospital, they might have measured his antibody level and found that he didn't have enough protection, maybe based on age or status or just your overall immunity. Mm-hmm. So that becomes an issue, especially with people who are immunocompromised, as even after 4 doses, they still don't have anything or less than 20% of antibody formation. So that may be something that they recommended based on some of his test results.
I see. All right, thank you.
Okay, this is an article that is speculative. And it's speculative based upon what's happening in other locations. The experience in South Africa and other places is that the virus peaked after a short period of time. And so the hope is that this will happen the same way here. There's no guarantee that's the case, but it's the hope that that by the end of this month and by the end of this next week, that the Omicron surge will start to fall. There's some evidence in some states that that is the case. The question is, will every state be the same? I don't know.
Excuse me, doctor, why do you think that the United States had it worse than other countries? Do you think because of the people's attitude? Do you think
Well,
that's what made it worse here? People
I
were more
think
compliant in other countries, and we were more individuality rather than thinking of everybody.
well, I don't know the answer, and I suspect that a lot of it has to do with the institutionalized racism that puts people in different classes. So if you had, if you're in a class that, if you're obese, if you're older, if you're Black and you have less access to health, then you are predisposed. So my perspective was that what it did was unmask institutionalized racism. That's my perspective on it. But Velma, what are your thoughts?
I guess I'm not necessarily think it's worse here. I think part of the issue is that people feel, I mean, we still have the right to not get vaccinated. It's all about their rights, but it's the same thing in England and different countries. I think they all have that aspect of a third of the people wanting to maintain control. I think a lot of European countries have Europeans have a little bit more respect, have more respect for the government, maybe, than here in the United States when everyone wants to have their say. But when we look at the Asian countries, the government have control, so they have to wear a mask, they have to get vaccinated, and there's respect for that. So I sort of agree with Dr. Callender in that a lot of it has to do with the attitude of either disbelief or just wanting to maintain their own autonomy by saying they're not going to listen to the government.
Well, we will soon know whether it's peaked or not. Now, this is something that we talked about last week as well, the fact that there are unapproved testing sites that pop up that are bogus, and you have to be very careful and be sure that you're at a legitimate site and you have the appropriate testing. That's why the points you made earlier about those people having access to the rapid tests becomes important. Because the more people have the legitimate tests, the better off we will be. And I don't know how you are able to check out the pop-ups and the fake ones, but
yeah, I generally go to the state website for valid COVID tests and curative in our area. Someone knocks on your door and offers you masks and asks you to try them on, don't do it, because the masks have been laced with something to knock you out. They ask you
Wow.
to try it on to see if it fits you.
Wow.
So they say they're from the government giving out masks and just want to make sure that it fits you well. So that, no, don't, pass that on, make sure nobody's taking anything that comes to your door.
Man's inhumanity to man is just remarkable that people would do that. It's
Any way to
amazing.
make money.
Amazing. The love of money is the root of all evil, huh?
Yeah, the other thing is that we used to have to worry about people coming and knocking on the door when they had a mask on, because they were hiding their face because they're going to rob you. Now they come and offer you a mask. That's ridiculous.
And they still rob you.
Yeah, well, these days are challenging. Now we
I
do
don't
know
think people open their doors as much as they used to back in the old days.
that's correct. If you knock on my door, you're not getting in. So
Right,
knock if
you're
you
not
want.
getting in either. And if you don't call and tell me you there, you definitely, I don't even go to the door, see who it is.
I agree. I got that warning too, and I was told to spread it around about someone knocking on the door. They'll offer you a mask, knock you out, then rob you. People just don't open their doors anymore.
Right.
The average person.
Right.
Yeah.
And on most seniors' doors now, I had them put a sticker up says no soliciting. So won't nobody come knocking on their door, because sometimes a senior forget and open the door.
Yeah. Yeah. Well, it's illegal to open the door when somebody knocks in my house. Yeah. Well, yesterday was the 19th, so we shall see. Well, I think it's now one of the question is, when will it stop? We've started this and we have the sites open now. I got a request to give a talk somewhere in March, and I turned it down because I didn't feel comfortable, number one, going to California in March, and two, at my age now, when I travel, if I'm going to go out to California or go to Europe or somewhere, if they can't give me first class, I'm not going. So, so this is an interesting aspect of when will it be safe to travel again like we used to? And that's an unanswered question.
It might not never be.
That's right. Might not be.
I think it's the age group you're in, because my children, grandchildren, they all feel that it's safe and to travel, and they're traveling extensively. And then I got a couple of friends, they're still traveling. So
that's correct.
I don't know if it's the age or what, but a lot of people are still traveling and they haven't stopped.
And they've canceled a lot of the trips, the boating trips. As a matter of fact, they've canceled a lot of them. You're right. There's a group that continues to travel as though nothing's happening, but there's a lot that is happening, and a lot of places are canceling. And to be aware of the locations where you're likely to get into trouble is not necessarily on the airplane, but it's getting to the airport. Right, the airport, yeah. And the same thing with the trains, etc. But anyway.
So Dr. Callender, you think by riding first class, you get have less chance of getting COVID?
No, no, no. It had nothing to do with riding first class. Has nothing to do with the virus. It had to do with my comfort.
Oh,
If I'm going to take a flight to go out to California, which is 5 or 6 hours, I'm not going to do that anymore unless I get first class. If I have to go out to Europe or somewhere else. So it just means that for my comfort, I'm not going to be doing that like I used to. I used to fly everywhere all the time, economy, but I'm not going to do that anymore. I'm claiming my age is the reason.
Mhm.
yay.
I'm about to
Yeah.
think back of you. I got a trip to California. I'm about to for February. I'm about to tell them, nah, I don't think so.
No, you're young. You're young. You're 20 years younger than I am. Right.
Mm.
So,
This
And
Sunday, I'm flying to Austin for a band rehearsal, so pray for me.
well, get through the airport quickly. That's all. Yeah. There's an issue that tells how you can use your reusable N95 mask. There's a lot of feeling that the cloth masks are not going to cut it. With Omicron, I don't know that there's tests that prove that, but there's a lot of people who say that. I haven't seen the tests that compare Omicron with cloth masks versus N95s. We all know N95s are the best masks, and we know that the surgical masks, layered masks, are a good mask. But the other masks, I'm not sure that we've seen the testing with Omicron that we've seen with the Delta and the other variants. But anyway, this article is pointing out that you can reuse the N95s under certain circumstances. And it points out that if you use the N95 for 5 minutes, go to a store and come back, that you could use it again. But if you use it for hours and it's tainted, you can tell it's tainted, then it's wise for you to use another mask. And it talks about how you can store it and how you can reuse it, steam it and boil it. And one of the things that I did have a problem with, I was surprised, was some of those elastic things break after you use them. But other than that, it seemed to be even more comfortable and easier to breathe with the N95s than the others. What has been your experiences?
Yeah, I got the surgical masks. At first, I got like 50 of them. I think out of those 50, probably 10 of them, the strap broke.
Interesting.
I found a N95 mask around the house. It had a whole lot of makeup on it.
Yeah, later.
I never heard of that one.
Well, you got to take your makeup off before putting it on.
Woo!
Woo.
I've been washing mine.
And you can
And how-
watch them. You can. They mentioned that. Well, you can boil them, or you can. Well, yeah.
Put them in the oven. They said also.
They also give you a limit of times you should read. They talk about 20 times for some. Is the limit. They talk about counterfeit N95s. Anybody encounter those?
No, I have a friend that ordered some and they came back and she said when she was the package was so hard to open, and when she got them open, when she tore it open, she had tore half of the mask up trying to get the package open.
Oh.
Well,
And they came from overseas and there was no English on the whole package. And
Oh,
she ordered 50 of them and only 20 of them she was able to use.
well, if she destroyed them, that's not their fault.
No, what I'm saying is that they were destroyed when she opened them up. She thought
Yes.
she thought she had destroyed them, but the way it looked like, she said they were all melded together, like they had melted or something.
Oh, really? Oh, that's different. Oh, okay. Where did she get them from?
She got them off of a website and they came from China.
Oh, yeah, I see. Yeah, I have some Korean masks as well, which are pretty good, but not quite as good as the N95. It's interesting. The breathing is in some ways easier with the N95s. But you're right, you can get them from a variety of places.
Yeah, do you remember the hand sanitizers from Mexico with the methyl alcohol in it?
Yes.
Yes.
That's what this reminds me of.
Yeah, you have to be careful, right? Yeah. But anyway, it's an interesting time. It's an interesting time.
You know, I got some N95 masks last week and actually got them from the last 2 boxes at the Home Depot.
No.
Because when I went on the CDC,
Oh, snap.
a whole skid of them, he said within a half an hour, it was 2 left.
Well,
I
now
want
they're
to go
gonna.
back. I want to go back for a second. This right here, the NIOSH markings. That's what you really look. That's what you look for.
Yeah.
The NIOSH.
Oh, SH mark, yes.
If you see that, then you probably be okay. Some of them have it spelled incorrectly. Some of them don't have that marking.
Right.
That'll be what you look for. And now we're getting them in the mail now.
Really?
Right here.
Well, anyway, I think Biden is trying hard to do the right thing. I must say about Biden, he's trying to do the right thing.
Did everybody register for this? It came out yesterday. Did everybody register for their mask?
I was
Yeah,
able to register the day
Yes.
before on the 18th.
No, I didn't, John.
I hadn't seen anything regarding the mask. I saw for the
Kids.
kits.
For the kids.
Yeah.
But
No, the
this
mask
came
was
out
supposed
after
to
that.
been yesterday, the 19th.
Yesterday.
Yeah, I
Right.
got the mask. I got both of them. Came up on
Yeah.
my phone.
Oh, can someone
See?
forward it or put it in the chat?
Sure.
The contact information?
There you go. It came up on her phone.
Mhm.
I didn't get that. What about the mask? We can
I
get
didn't either.
masks.
Yeah.
And you have a phone.
Okay, so who got it?
Well, the
Let me
mask.
see. Wait a minute.
The mask link comes out next week.
Oh.
No, the mask link was out this week. You were supposed to go online on the 19th, and I had the information. And then I have a friend who's a nurse, and she called me on the 18th and said, "Do it now." I did it, got through. I called some other people. I even called people in Ohio. She did it, got through. I'm trying to see where's that website.
Yeah,
Are
we
you sure
registered
it wasn't for the
for the
test?
test. That was
That's the only one I had was for the test.
The test
No.
came out yesterday. The mask is not out yet. That doesn't start till next week.
The
Yeah.
mask is out.
Okay.
I did it.
Show
I'll
us.
see if I can find it. Okay, wait a minute.
Did you get it already?
Put it in the
I
chat.
haven't received it.
that's
Again, you
fine.
have to go online and order. And it took 2 minutes tops. Really, seriously. Let me see
You
where
mean
it
to order
is.
it, not to receive it, though.
Not to receive it, not to receive it. I ordered.
Can you just put the link
It
in
has
the
been
chat?
out for several days, but you're supposed to do it on the 19th. And I got a call to go ahead and do it on the 18th. And it went through and I got the confirmation back. I'm trying to see where it is. Let's see if I can
Did
see
the
it.
confirmation come back from the United States Postal Service?
You got it, yeah.
But it
That was
says
for
starting
my,
next
that was
week.
for my kit. It didn't
That
do
was
that.
for the, I had that for the tents.
That's for
Right.
the test kit.
Oh,
Right. That's not for
okay.
masks. That's not
Okay,
for
that
masks.
was the
Masks don't
kits.
even start till
That was
next
the
week.
kits.
Yeah.
Mhm.
All right.
Yeah. Masks don't start
Yeah.
till next week.
Right.
I said
I
that
got a notice. I didn't do anything. It said, it just told me, it just keeps coming telling me different things. Because of this thing I signed up for in DC.
and I think they can give you 4 test kits per household.
Okay. That was the kits, yeah.
Yes,
With the confirmation from the post office.
yes, yep.
Yeah.
Okay.
Well, you know, I think it's clear that Biden is trying to do the right thing. You know, he's had a incredibly awful first year,
Mm-hmm.
but it's not how you begin, it's how you end. So
That's true.
he's trying to make up for it. He's handling,
Yeah.
he's doing his
Well,
best.
and he's taking responsibilities, not
Yes.
blaming other people.
That's
But he
correct.
needs to start calling out what's happening and telling people what's happening.
Well, he
We
was
got
doing that on.
we got 2 Democrats that are messing up everything for everybody else. Well, they call themselves they're just
Now,
spoilers.
that's correct. They
Mhm.
call
They're
themselves
not
Democrats. My mother's 91 years old, and she said that's a Republican line and a Democrat suit. And all I could do was look at them.
They ran on that ticket to win.
Right.
Now, the thing about the N95 is, what surprised me is that the breathing can be better with the mask. Some of the other masks, you can't breathe as well, and
Mm-hmm.
it becomes an issue.
Mm-hmm.
Yeah, what good is it to wear a mask if you're gonna get suffocated?
But you breathe well with the N95 because it's like a respirator, because it's a tight seal, and that's the surprising aspect of it. And in the hospital, you know, they give us N95 a fit test that we have every year, and they had those N95 masks. And what they would do, they'd inject something, and if you could smell it, it meant that the mask was not functioning right.
Oh,
And that's what makes the N95 different.
And how much does facial hair affect it?
Oh, I don't know. I hadn't thought about that. I don't have much facial hair. So people who have beards, I don't know. That's an interesting question. I don't know the answer to that.
Yeah, I know when we go scuba diving and you put a scuba mask on, a lot of people use Vaseline on the hair to maintain the seal. Otherwise, every strand of hair without that Vaseline becomes a leak, an air leak. Every strand.
I think Kevin's talking about nose hair.
No, I think it's talking about
No, I'm
facial
talking
hair.
about facial hair,
Facial
beard
hair.
and
Talking
everything.
about facial hair. Talking about
Because
facial.
I've worked at jobs where we had to wear a respirator and you had to cut your beard off,
Yeah, probably. Yeah.
you know, because you had the fit test and everything.
Right. That's right. Exactly. Yeah. Well,
So that means you won't see a doctor with a beard.
that doesn't. Doctor's behavior has nothing to do with this, Carol.
Oh, okay.
Definitely not long nose hairs either.
Well, if it's on properly, the nose hairs don't matter, but because the fit has nothing to do with the nose hairs, but the fit has everything to do with the facial hair.
Yeah, the nose hair is good for fighting off stuff, bacteria.
Okay. Most people are going to get COVID. Well, fortunately, if most people get vaccinated, then the people who eventually the people who are not vaccinated will be protected. That's herd immunity, and in a sense, that's what's going to have to happen. Of course, we aren't close to that yet. But I think he said something about 60 to 70% were vaccinated. I don't know whether that meant fully vaccinated or not, but 70%, 60 to 70% were vaccinated. Now, I thought this is going a bit far to find unvaccinated adults. That's Canada. What do you think about that?
I agree with it entirely.
I agree with it too. I
That's
agree with that.
That's
Way to
undemocratic.
go.
I'm
Mhm.
okay with it.
That's right. Mhm.
That's undemocratic.
Yeah, I'm okay in Canada.
What does democratic have to do with this?
You have the right to not be vaccinated. That's what, the right to not be vaccinated if you don't want to.
But the right to be unvaccinated here in the United States is what people are attributing to Biden's lack of approval. I'm like, they need to bring that up, that because they are unvaccinated, so many are, he can't do anything about it.
Well, I think the one of the things that we don't talk much about is that you're able to do what you want to do as long as you don't harm anybody. Well, the belief is that if you're unvaccinated, you do harm. And so some people feel that because of that, that it's okay to require vaccinations. I don't know the legitimacy of it, but I know, for example, when I was younger and I had TB, you had to be isolated. And so that may be similar to those people who refuse to be vaccinated because they can do harm to others. But anyway, that issue is not gone to the Supreme Court yet, but it may well go.
Well, why can't they bring up the case of smallpox, how they eradicated it through a vaccination?
That's correct. Yeah. Well, they can
That's
bring that up.
logical. So people that don't want to eradicate it, then they can buy their own country and live by themselves. But
No, I don't
it
think that's
doesn't
gonna work.
matter. And you're trying to protect everybody. You're selfish. So fine them. Let them pay for their freedom.
Well, anyway, they're doing it in Canada. I'm not sure it'll work here. But it's been interesting.
I love Canada.
Well, we'll see. We'll see. I'm for them having the right to be unvaccinated, but I think the fact is that it does do harm, and so if it stood the test of time, it may well be something that could fly. But I have doubts in the United States.
How
The
is that any
Democratic-
different, Dr. Callender, how is that any different from carrying around a gun?
Well, you have the right to carry a gun.
Yeah,
You have the right to carry a gun.
yeah, out in the open, you have to have a license or something. So maybe they should have a license to be not vaccinated.
Well, this is food for thought. I think it's food for thought. Right.
Dr. Callender, I have a question. You know, the vaccination we got as a kid, what was that vaccination for?
Oh, we got diphtheria, pertussis, and tetanus. And then we got vaccinated for, now we're getting vaccinated for HPV and other things. But early on, it was DPT.
Yeah, I got the smallpox, right? That's that keloid on your arm, and also polio on a sugar cube.
Right. The smallpox, yeah. I don't think the smallpox was given for children.
I
I
had
know
Dr. Callender?
I got it later on when I went to travel to go to Africa. I got the smallpox.
Dr. Callender, is there any statistics for children who never received any vaccines and are now adults, or will it hinder them later in life, or?
I haven't seen any data on that. Velma, have you seen anything like that? I haven't seen any data on that. It must be a small number who have refused, because in order to go into school, you had to be vaccinated. So I don't know, but that's a good question. I don't know the answer.
Velma went back to work, I think.
Now, this article is on whether you should do your throat test and your throat first. So that has not been dealt with yet, because most of the tests are done in the nasopharyngeal area. This is suggesting you might do it in the throat as well, or in spite of. But so far that has not been tested. But there are some people who think that because you get a sore throat, therefore the back of the throat should be tested as well. But that has not been accepted, and most people are still doing the nasopharyngeal.
You probably have a gag reflex if you try to swab the back of your own throat.
Yes. Yes. So time will tell as well. They'll do more and more tests and come up with an answer, but we don't have an answer yet. Remember how they used to go so deep into the nasopharynx? And they've stopped that now. They just do the lower part of the nasal passage, and they still have the accurate tests. Now you remember that the National Basketball Association did saliva tests, and they determined that that was as accurate as the nasal test. But nobody's adopted that though. So it's weird, but we'll get the answers eventually. Okay, next one. Well, this is a disappointment to some that the Supreme Court allowed the vaccine mandate for healthcare workers, but did not allow it for other businesses. And even that was 5-4. So, but anyway, it was accepted, which means that those people who are fired remain fired. Yeah. And I agree with Biden's point that fewer than 35 million are unvaccinated. So that's because of the mandate, I think. Anybody not agree with the Supreme Court? One of the things about the Supreme Court is that the margins are very narrow often, and they've approved some horrible things, especially as it relates to racism. They approve some horrible things, and so
the worst president was able to have 3 justices on. That's the worst part. He
yeah,
appointed 3 judges.
yeah, that is frightening. And that's why it's bothersome to me that we put so much stock on the Supreme Court. Look at this. We see a Clarence Thomas. He's always there,
They stay too long. Some of them need to be retired.
That was one of the worst things we ever did, was putting Clarence Thomas on the Supreme Court.
He's one of the younger ones, and
tragically.
Yeah.
This is something that I thought is very welcome. 911 we know about. 988 is a suicide hotline. It's not live yet, but in July, it's hopeful that when you have somebody who's thinking about suicide, you can call 988 and get them some help.
Is that the same thing as they're trying to launch for children where they can text?
No,
Okay.
this is only for suicide.
Okay.
If you have somebody who is suicidal, you can call 988 and they can have somebody mobilized to take care of them.
Okay.
It's a brand new, it isn't operational until June or July of this year.
Dr. Calder, who is the organization that is responding? Is it somebody in the federal government? Is there a company?
This will be statewide in every state in the United States. I think this is the consequence of Mental Health Services Administration and working to try to make this happen.
Dr. Callender, back to the Supreme Court for a minute. I've always thought that passage should be 6-3 instead of 5-4. 5-4 is too close.
Well, I think it doesn't matter what we think. The majority is what it, and that's the majority rules.
Yeah, but 6-3.
Majority rules. So
they call it a super
but that's
majority.
Majority rules means that whatever the majority says rules.
So 5-4 is also a majority, but it's
Well,
not a high enough majority.
Well, that's the Tatum perspective, but majority rules mean that the majority rules, whether it's 5-4 or 4-3 or whatever. So, because if we waited for 63, many things would never pass. And you as the what's your title, Tatum?
Parliamentarian?
Yes, you know that the majority rules. All of the rules say that the majority rules. So even if it's one vote, that's it.
Yeah, but the higher the test, like you said, things would never get passed.
But that's the Tatum rule.
6-3.
Dr. Callender, what I was asking about, but now I see it. DC is launching a free mental health tech service available to many DC youth through AmeriHealth. And from ages 13 to 20. So I see, I got it. Thank you.
That's different, right. I didn't know that Canada had lupus, but that's a disease that is very common, autoimmune disease, especially in Black women.
Yeah, I'd never heard of it, a man having lupus, but it's when you have it and you're on treatment for it, that means you're going to be immunocompromised as well.
Well, the treatment for it is to give you steroids. So so therefore, if you're on steroids, yes, you would be immunocompromised. Now the issue though is that you don't take steroids always. You take it to overcome the episode, and thereafter you may take very small doses of it. So that how immunocompromised you are depends upon how many episodes of lupus you have. And some people have to be on steroids long term, which means they would be immunocompromised. This is an article about Australia has decided after locking down for such a long period of time that they're going to reopen. However, you must be vaccinated to get into Australia, as Dakovic found. But
Yeah.
and they have parts of Australia where they don't allow you to come in from other parts of Australia. But at this point, because of Omicron, they're deciding that they had it, and they're going to let Omicron do what it's going to do. I thought it was an interesting situation that they approved and then disapproved Novak Djokovic's situation. But they're one of the countries that demands that you be vaccinated if you come into their country.
Yeah. Well, I guess they figure we got enough nuts here. We don't need to import none.
Yeah. Well, yeah, it was frustrating for Novak, but and then when you
Yeah,
get
he got the
deported
wrong
like that,
attitude, according to me.
what's that?
I say he has the wrong attitude, according to me, because he first tried to lie and say that he had it. I think was he the one that had the false?
No,
He said he was
that was
vaccinated, didn't he?
the other.
no,
other-
no. The falsehood about him was that he had been to other countries that he didn't put on the information.
Right.
But he did, right, and he said he didn't do that. They did that. But and then but he did not falsely allege anything other than that. And he's been a strong anti-vaccinationist, so suffering the consequences.
This is the last one.
Yeah, the genetic risk factor found for smell and taste loss. And it's interesting how everybody who has it does not lose its sense of taste and smell. And there are other viruses that do the same thing. So it's not unique to COVID. And they found 2 olfactory genes that were responsible for it. So this explains why some lose taste and some don't. The other interesting thing that hasn't been addressed recently is the fact that their interferon. Interferon is a product that protects against getting pneumonia from COVID. And if you don't have the interferon protective gene, then you would get the pneumonia and die from COVID. So a lot of it is related to your genetic disposition and your ability to have an immune system that fights off certain things. And apparently there's been some blocking antibodies for some people. And if you have this defective interferon, then you're likely to die from COVID. That's something that was identified earlier.
That's it.
You want to discuss anything else? Any new items?
Just
All
a quick
items that
question. Is that interferon the same as the medication that they use for hepatitis?
Yes.
Okay.
Yeah, and some people have anti-interferon antibodies, which makes their ability to utilize the protective aspects of interferon, which are immense, they do not protect them against COVID, and they're the ones who die from COVID for the most part. It's the same interferon. It's a protective antibody that the body makes. Just as in cancer, there are some antibodies we have that prevent our own protective antibodies from destroying the cancer cells. And so these new treatments and cures for cancer eliminate those antibodies that prevent our own antibodies from killing the cancer cells. And this is what these new cancer treatments do. They knock out the antibodies that are preventing our immune system from killing cancer cells.
Dr. Callender, is there any place that we can go to find out the effect of having, I think I asked this earlier, having recovered from COVID? And I'm pretty sure I had Omicron because my symptoms were very mild, just like a common cold, really. And our ability to be reinfected or infect other people, you know, as a result. Are there any studies out there right now about that?
None that I've seen.
So are there any, aside from just masking and the general behavior that we've learned, masking and hand washing and things like that, is there anything that we should be doing in our homes to prevent reinfection or infecting others?
Well, I think what you can do is try to limit exposure to unvaccinated people. Probably the only thing that I know of. And if you get exposed, they do have treatments that can prevent you from contracting it. They have antibodies. Now, whether they're operational against Omicron is subject to question, but people are still treating, using the antibody treatment as though it were effective. So if you're exposed, there's treatment for it. But the other things that you mentioned are the operative treatments.
There are also indoor air filtration systems.
Yes, that's right. Yeah, that are the same thing they use in the hospitals and in the airplanes that try to allow the air to be germ-free and virus-free.
Are those HEPA filters? Is that what you're talking about?
Yes.
Are they kind of expensive or?
Yes. But I don't know the cost, but they use it in hospitals and in the airplane.
But it's close to my job.
Yeah. Those carbon monoxide filters and replace them with the Omicron filters.
Who's pushing that?
Okay, that's it for today then, and you'll have a great week.